In this video, we will see about the differences between placenta previa and abruptio placentae. Both these constitute the antepartum hemorrhage. We have seen about placenta previa and abruptio placentae individually in detail in our previous two videos. So, now in this only we will see the differences between the two. First, placenta previa and abruptio placentae. So, we will see the differences. First point is the bleeding. Bleeding in case of placenta previa is sudden in onset and it is always revealed. That is, it always comes out, there will be bleeding per vaginum and it is bright red in color. Whereas in abruptio placentae, the bleeding may be concealed or revealed, or it can be of mixed type, and the blood here is dark red in color. This is about the bleeding. Next, coming to the pain. Placenta previa is mostly painless, whereas the pain is always present in abruptio placentae. And the clinical features in case of placenta previa are proportionate to the blood loss. That is, how much ever there is blood loss, there will be clinical manifestations according to the amount of blood loss. Whereas in case of abruptio placentae, it is usually disproportionate to the blood loss. Even in case of mild blood loss, there will be very high clinical manifestations. Next is about the uterus. The uterus in case of placenta previa is soft and non-tender, whereas in case of abruptio placentae, the uterus is tense and tender. This is a very important point to differentiate between the placenta previa and the abruptio placentae. In placenta previa, the uterus is soft and non-tender, whereas in case of abruptio placentae, the uterus is tense and tender. Then the height of uterus. The height of uterus corresponds to the period of gestation in case of placenta previa, whereas in case of abruptio placentae, it is more than the period of gestation. Next, the fetal parts are usually easily palpable in placenta previa, but it is difficult to palpate or not palpable in case of abruptio placentae. Next, malpresentations. Are common in case of placenta previa, whereas they are uncommon in abruptio placenta. Fetal heart. Fetal heart is usually normal and the fetal heart rate is easily heard in placenta previa, whereas in abruptio placentae it is difficult to auscultate the fetal heart sounds, or they can even be absent. There will be more associated problems These associated problems like preeclampsia are more common in abruptio placentae, whereas in case of placenta previa there will be usually no such symptoms. Next, there will be coagulation problems. In case of abruptio placentae, unless treated early. Whereas there will be no such coagulation complications in case of placenta previa. So, this is the overall view, the important differences between the abruptio placentae and the placenta previa. Let us have a quick recap. The bleeding in case of placenta previa is sudden in onset and it is always of revealed type and the color is bright red, whereas in abruptio placentae the bleeding can be either concealed, revealed or mixed and the color is dark red in color. Abruptio placentae is a very painful condition, whereas placenta previa is painless. And coming to the clinical manifestations, which are proportionate to the blood loss in case of placenta previa, whereas the clinical manifestations are very much disproportionate to blood loss in abruptio placenta. Next, the important point is about the uterus. Uterus is soft and non-tender in case of placenta previa, whereas the uterus is tense and tender in abruptio placenta. Height of the fundus of the uterus corresponds to the period of gestation or the period of amenorrhea in case of placenta previa, whereas in case of abruptio placentae it is more than the period of gestation or the period of amenorrhea. Then the fetal parts are easily palpable in placenta previa, whereas it is difficult or not palpable in case of abruptio placenta. Then the malpresentations, which are more common in placenta previa, but they are uncommon in abruptio placenta. The fetal heart rate is normal and they can be easily heard in case of placenta previa, whereas it is difficult to auscultate or even the fetal heart rate is absent in case of abruptio placentae. And the associated problems like preeclampsia are more commonly seen with abruptio placentae, and also the coagulation problems, which are also seen in abruptio placenta, not common in placenta previa. So, this coagulation problem in abruptio placentae, unless they are treated early, there can be disseminated intravascular coagulation. This is a very important and a serious problem. So, these are all the major differences between the two types of antepartum hemorrhage, which are placenta previa and the abruptio placenta. For more detailed information about these two, check out our previous two videos. One about the placenta previa and the other one is about the abruptio placenta. Thank you.